All right, everybody should have just heard the recording button there go off on Zoom. Thank you for joining us this afternoon on May 21st. We're going to be going over unauthorized health insurance enrollments and scams today, a topic that is gained a lot of press and attention in the last, I'd say, 5 months, I would say, is really kind of where it's been spiking, and our interest has grown as we see consumers impacted by it. So we know a lot of our attendees are interested in what's going on and what we'll be able to do about it to help assuage and mitigate this problem moving forward. Next slide, please. All right, we have our two esteemed presenters who I am quite honored and pleased to call my good friends, Caroline Gomez-Tom, our Enrollment Network Accessibility Manager here at Covering Wisconsin, and Julia Garvey, Policy Advisor, Navigator at Partnership Community Health Center, and Champion of the People, let's call her, because she does a lot, and she's got a lot of really firsthand experience with this stuff, and she's going to share some examples that people should find really interesting and compelling. And next slide, please. We are also joined. You'll see myself there in the middle, Navigator Program Manager covering Wisconsin. I'm Adam Van Spankeren. I will be the host, mostly sitting back and curating your questions and answers as they come in. I'll talk about that more in just a second so everybody kind of knows the score and what to do. But we are joined by Marcel Gomez, the Enrollment and Outreach Coordinator for BEEP at Department of Health Services, and Amy Sather, a Policy Advisor Navigator at OCI, the Office of the Commissioner of Insurance. And we are very pleased to have them join us. They will jump in with any questions that are particularly relevant for their respective organizations or programs. And next slide, please. All right, Q&A. Zoom webinar, we have a lot of people on, so unfortunately can't just let anybody unmute and talk anytime they want, which is my favorite kind of presentation, nice free for all. But we do have a lot to get through today, and we know that a lot of this is new. So as you think of questions, please put them into the Q&A. I will be monitoring that, curating that. I will answer some live if I can, but I have a feeling that a lot of these are going to spur further thoughtful discussion amongst our presenters and our panelists here. And I think that it will really be to the benefit of everybody who's joined us and everybody who checks this out later to have those discussions. So I will check them out, I'll flag them, but we'll be doing Q&A, saving it all for the end. So if you don't get a question in real time, don't panic. We will bring it up later and make sure we get to everybody's questions and answer them as best we can. Like I said, a lot of this is new, but it is all really, really important. And we are really pleased to have you all join us for this webinar today. So I will talk briefly about the agenda before turning it over to our main presenters, Caroline and Julia. So we'll be looking at the latest information and statistics on these unauthorized enrollments and scams, the different types of fraud and fraudulent activity we're seeing, so people know what to be aware of. We'll look at very recent examples of what's going on in Wisconsin, as well as what enrollment assisters and others, not just enrollment assisters, but what everybody can do to help consumers who are experiencing this fraudulent activity, these scams. We'll talk about some prevention strategies, what we can do moving forward, some free help for enrollment escalations and complaints. So if something's just a little bit out of your league and you want to connect with Covering Wisconsin or some of our esteemed partners, we can do that. And we will have that Q&A that I referenced. So without further ado, I'm going to turn it over to Caroline and Julia.
Thank you so much, Adam. I am so thankful to be able to talk on this topic. This has been a hot topic for quite some time, and I'm thankful that we have our partners from the Department of Health Services and the Office of the Commissioner of Insurance to help answer questions. But I also want to thank some of our partners that are on this call, in particular, some of our state and nationwide partners who have maybe been experiencing these issues longer than we have. And we'll obviously dive into what I mean by these issues. But I want to recognize them because some of the information that we share today are essentially things that we are learning in real time, that this is an ongoing issue. And this is only just the beginning in sharing this widely with our partner networks across the state of Wisconsin. And we'll be continuing to learn from what other states are learning, from what the federal government is sharing, and also what we can do here locally. So I wanted to just give that context and thank everyone for attending. All right, so the first section is a storm is coming. As we know, in most healthcare outreach, education, enrollment work, is that really anytime there's a change in policy or a change in how things are administered or a new law presents itself, there's always a let's say a change in the weather in the air that there's a chance that there may be some folks who are, because they're confused, because they're unsure, can get easily tricked or taken advantage of. And bad actors, unfortunately, are very aware of this, which is why we always see an uptick in some kind of scam or concern or issue when we see anything new come to the work that we do as navigators, agents and brokers, and certified application counselors, or enrollment network, enrollment assisters. Thank you. Sorry, I'm thanking myself for correcting myself because I have word soup in my head at the moment. But I'm very excited to be able to highlight this now so that we can get ahead of any ongoing lingering issues as things start to pop up. So in Wisconsin, we knew that Medicaid renewals were happening. People are transitioning more than ever to other forms of coverage like healthcare.gov or insurance through an employer. And then we started to see some issues start to pop up. Unexpected text messages and scam calls were prevalent during the pandemic. Ads for free plans or ads for plans, and then you get gift cards or something else were common throughout these challenging times when people needed access to additional resources. So then we start to get wind of this other issue across the country where out-of-state web brokers, all of those folks that are connected to the websites that we tell you not to put your information in or sign up through, we start to hear that people are getting these aggressive sales calls, essentially into the point where they have to at least agree to something, otherwise they can't get off the phone, or they're just unsure because anytime they ask questions, they're not getting direct answers. Or people are figuring out ways to get access to individuals' malicious use of information. So finding out how to get access to protected consumer information through unknown means. And now it hits where nationally, we just heard from the Centers for Medicare and Medicaid Services about 2 weeks ago that there have been 40,000 complaints to healthcare.gov about unauthorized plan switches, and then another 50,000 complaints around unauthorized enrollments. And yes, they are working tirelessly to address these and have actually resolved many of the complaints that went to healthcare.gov. But as we know, as many enrollment assisters or community members know, we know the ones that are being reported are just the tip of the iceberg. And really, there are probably far more that need to be addressed. And I'll say, mind you, that these 90,000 were in the first 3 months of 2024. And so we know who these folks tend to reach out to, and we know that it's everybody. Anybody can be a victim to fraud or bad salesmanship or really just complex information not made easy. And they're using tactics by reaching out to folks through these aggressive phone calls or bad websites, or in some states, they're actually even going to folks directly, whether it's people who are unhoused, immigrant communities, senior communities, and are directly trying to get them to sign up for plans that will benefit them, but not necessarily benefit the individual. And they're using language like marketplace coverage is better than Medicaid, or you can have free insurance. More insurance is better. I can get you coverage for a few months. And this was a particular sales pitch to immigrants who wouldn't otherwise qualify for coverage. So they were signing people up that didn't actually have access to healthcare.gov. And now it's popped up in the news. So we're seeing more and more that these plans have now made its way to more mainstream information sharing news and media. And so we've been following along, but the signs and symptoms have been here all along. And what that means is we, as Covering Wisconsin and our navigators and our enrollment assisters, our enrollment networks, we have been connecting the dots. And we actually started hearing about these reports of people being duly enrolled, people being essentially on plans that they didn't know they were on, and all of these other unusual and unexpected changes that were coming up just through our natural modes of communication. We also participate as Covering Wisconsin in the Center for Budget and Policy Priorities essentially group, where they bring in national partners that are navigators and other types of enrollment assisters to talk about trends that we're seeing in our states so that we can identify when something is going well and when something is not going well. And this was a trend that we started to hear about more and more as these calls happened once a month. Finally, the CBPP, or the Center for Budget and Policy Priorities, they were able to get a phone call or a Zoom call with the Center for Consumer Information and Insurance Oversight, or CISIO, which is the insurance arm of CMS or healthcare.gov. They're the ones that manage healthcare.gov and really how it's managed. And we were able to share what we've seen in our states. And we've seen quite a bit. Through our enrollment networks, we were also able to identify a lot of different cases. And what we were hearing from partners directly, the managed care organizations, qualified health plans, local agents, and brokers were telling us that they also saw an increase in spam calls and predatory sales behavior by out-of-state actors. Medicaid members were enrolled in healthcare.gov at the same time as they had their Medicaid benefits. And this had happened in the past, but at the volume that it was happening, it raised a lot of red flags. And then we had a huge number of health systems reach out to us to tell us that there are many of their patients are in these out-of-network plans, even though they've been patients for that health system for so long, that it would be ironic for them to not try to at least get into a plan where they would maintain that type of care with that health system. And so a lot of these things were happening. And so we were able to share, but then we saw what other states were experiencing. So for example, in Texas, bad actors were targeting people with non-qualifying immigration status, and they were told that they could be signed up and enrolled for coverage for 3 months. And the reason that this 3-month number was important was because that's typically how long it takes for a consumer or how long they get in order to report their identity and immigration status if they didn't do so in the application. So really what we're seeing is bad actors are completing these applications on behalf of these folks with varying immigration statuses that don't qualify for healthcare.gov, like someone who is undocumented, or before November 1st, someone who has the deferred action for childhood arrival status. And they are telling them you'll qualify, but then they're not obviously putting in the correct information. And then 3 months down the line, those individuals lose coverage, maybe didn't even know they had coverage, and are none the wiser. However, the bad actor gets the commission. Then in North Carolina, bad actors had been targeting people at homeless shelters. Navigators reported consumers having trouble at tax time, needing to reconcile tax credits that they didn't even know they had. So that's when someone was going to fill out their tax forms, and then they were told that they couldn't finish filing their taxes because they needed to reconcile the tax credits they received from healthcare.gov. Well, many of these folks were reacting with, I didn't know I had tax credits. I didn't know I had a health plan through healthcare.gov. I didn't know I needed a 1095A form. And that's if they even know what these concepts are. But if you didn't know and you weren't involved in healthcare.gov beforehand, you probably were just looking at the person like, what do I need to do? And that just is another can of worms. In Florida, so this is how long back this has been going and these issues have been popping up. 2 years ago, a county actually sent out a public announcement in Florida making an alert that thousands of people who were unhoused were being non-consensually signed up for healthcare.gov plans. So this is something that has been bubbling and brewing in Florida for quite some time. And then here in Wisconsin, once again, what we've been hearing from partners, folks duly enrolled in Medicaid and healthcare.gov plans to an extreme level. Numerous cases where people are finding out at the time they need healthcare that they are signed up for this plan that is considered out of network or is not what they thought they had in coverage in terms of Medicaid. And then people finding out that they have to figure this stuff out before they're able to get certain care and procedures. Other Wisconsin trends or issues that we're seeing are people who share their information on a site that they thought was healthcare.gov, but it was healthcare.com, or they Googled healthcare in Wisconsin or healthcare somewhere, and then they get these flurries of phone calls and texts by salespeople who just try to sell them anything and everything that's not suitable for them or not by explaining it to them. And then we hear a lot about near misses. So when we start to talk to a consumer as a navigator, we have to introduce ourselves. We have to go through our consent process where we talk about our organization, how we are licensed and certified by both the federal government and the state in order to provide enrollment assistance. And when we start talking about what we're supposed to do, what our responsibilities as a navigator are to help that person, then they say, oh, wow, I'm glad you're telling me all this because, a couple months ago, I talked to someone and they didn't tell me any of this and they were trying to sell me an insurance plan. So people that are so close to potentially getting scammed because they just happen to not decide to move forward with whatever that individual was telling them and decided to hang up and maybe figure out who was a better call to make. So now we have set the stage of kind of what we're seeing in our communities and nationwide, but then what has been the response from the groups that can address it? So as I mentioned, what we've said the problem is people being targeted, who, especially folks who may have a harder time understanding health insurance, which, like I said, can be all of us because health insurance is complicated, but particularly seeing these ads and incentives and things coming up in both Facebook and social media and radio to try to get someone to sign up for a plan that may not be right for them. And then, of course, capturing misinformed verbal consent. And I say consent because if you don't know what you're signing up for, you cannot actually give consent. But it also makes it hard to prove fraud if they technically have a verbal sign off, even if you're not understanding of what you're signing on for. Dual enrollment between Medicaid and healthcare.gov plans, so having both at the same time. And then unauthorized plan switching is when someone is signed up for a healthcare.gov plan legitimately that they chose, and then people getting into their accounts one way or another and switching it to a plan that gives them an incentive or gives them the commission. And that person might not find that out until, once again, point of care or the time that they are trying to use their health coverage. So CMS, as I mentioned, the Centers for Medicare and Medicaid Services have provided updated press release around these issues and stopping bad actors, because it has gone to an extreme where they know they have to react. And so they're accelerating monitoring and oversight activities. This is just the first of many essentially reactions that they will have to try to address this issue. But what that includes is issuing suspensions and terminations of agents and brokers as needed. So when they identify a bad actor, making sure that they no longer can do this work, whether it's temporary or long-term, to harm those individuals, barring them from being able to enroll consumers directly to healthcare.gov, adding technological protections to prevent unauthorized activities, and then considering imposing civil monetary penalties for fraud. There are those penalties already for navigators if we were to commit fraud. So now it's looking at some of these bad actors that may have not had those same barriers or restrictions or penalties if they were to cause harm. And then the Office of the Commissioner of Insurance, they were able to provide a bulletin to get some media attention, to bring awareness on this issue. And so they've also been providing social media posts, notifications to their partners. So our in-state trusted Wisconsin agents and brokers are now very aware of this issue as well. This directly impacts them, because if they are legitimately helping people sign up for health insurance and some out-of-state broker puts their name on it and switches them to a plan that really doesn't serve that individual, that's a commission taken away from our partner agents and brokers, or really taking money away from our state. And so they've been very involved and invested in this issue. And I know many of you partners are here on our call, so thank you. And of course, OCI has been working closely with us at Covering Wisconsin so that we can continue to lift up these issues. They have future plans to link information about scams to wiscover.com, which is a site that's managed both by OCI and the Department of Health Services and Covering Wisconsin, to better share coverage and health related information to all of Wisconsin. And then the Department of Health Services, because they are obviously very concerned about Medicaid members being taken advantage of and getting signed up for plans that they shouldn't be enrolled in because they have Medicaid. They have been sharing information with the income maintenance agencies that manage the enrollment and determination of Medicaid for individuals, because that's usually the first line of contact for many of the Medicaid members. When they have a question, they go to the IM agencies, as well as member services, to make sure that they can help direct consumers where to go for assistance. And then they've been able to share alerts to the health management organizations, or HMOs, which are the managed care organizations that help manage the benefits of the Medicaid members, to also raise awareness. So really, we're taking an all hands on deck approach to make sure that you all have the resources and tools and the knowledge and awareness of what's going on. And our consumers and the people that are directly impacted by this also know what to do. But to be able to do that, we need your help. And what that means is we need your help reporting when we experience these cases. So not just knowing about them, but really making sure that we share both with CMS and the Office of the Commissioner of Insurance, or the Centers for Medicare and Medicaid Services and the Office of the Commissioner of Insurance, when this happens and who is doing it. And we'll walk through this in the next section. But referring consumers directly to an enrollment assister to help resolve this coverage issue, so that they're no longer on a plan that isn't right for them in real time, as we also try to fix what needs to happen, whether there's an issue with using coverage, or any chance that they might have to pay for services that they accrued at the time that they had this bad plan. And then we need to educate consumers. We need to bring this to the public, because I imagine, as I mentioned, with 90,000 people reporting it to healthcare.gov, that there's still an additional 90,000 across the country that don't know that this is happening and it's potentially happening to them. And it's not until they need to use their healthcare in an emergency situation or where they're dealing with chronic conditions that they need to address that, essentially try to fix this scam. And when that's happening and you're in a stressful situation, that's the last thing you're going to try and fix is your plan, when really it's the care that you need in real time. All right, so now I'm going to transition to my great colleague, Julia Garvey, and we'll walk through more about how this fraud is happening.
Thank you, Caroline. Hi, everybody. Before we look at some examples of unauthorized plan switches and what it means to be enrolled into a plan that doesn't fit your needs, let's talk about what's happening in the health insurance landscape to even allow these fraudulent activities to happen. There have been a lot of well-intentioned opportunities created to allow people to get enrolled into health insurance coverage on the marketplace by creating new special enrollment periods. There's also been an easing of requirements to verify a qualifying event, all designed to make getting coverage more accessible to those who need it. In addition, the previous administration allowed an increase of third-party enrollment platforms and concurrently reduced funding to navigator entities, which provides unbiased assistance to consumers. So again, there was this perfect storm of well-intentioned opportunities to create access to enrollment that kind of lifted some of the guardrails and of course allowed bad actors to see opportunities to make a buck and in the process harming consumers. So let's look at some of the healthcare.gov special enrollment periods that is making getting insurance easier for people. And right now, one of the most used is those who are losing Medicaid through the Medicaid renewal process all the way back to May of 2023 can come on to healthcare.gov and attest a loss of coverage because they lost Medicaid, but it doesn't require a proof, a date. We can input a date, but it doesn't require you to show that you've actually lost that coverage. So that's one open door. Another special enrollment period for households with low incomes is that you can log into healthcare.gov and attest that your income is low. And that allows you to enroll into a plan any month and to switch a plan at any time. However, bad actor agents are falsifying incomes artificially low, offering free insurance, and then asking households in the fine print or telling them that they're required to provide updated household income information. Another opportunity that scammers are using is that low-income households can select a $0 plan. And by doing so, that plan does not require the household to make a minimum premium payment to start or to effectuate coverage. So by not having to engage in an act to pay for and start your own coverage, plans have been enrolled in on behalf of consumers who didn't know because they didn't have to take any action to start that plan on their own. Next slide, please. Some additional doors are that this automated process to enroll people into coverage by auto enrollment if you don't take action has created a multiple year, for instance, enrolled in Medicaid, but somehow got enrolled in marketplace coverage as well. I've heard stories of people terminating an additional marketplace plan when they've had Medicaid, but not knowing to indicate to not auto enroll you for the next year. And then come the next year, they're auto enrolled again. So that well-meaning opportunity to keep people enrolled in coverage has also maintained people in dual enrollments over multiple years. And lastly, and I've heard from agents that and other parties that they really point to these third-party enrollment websites like Health Sherpa as a way for agents to very quickly access someone's application and maybe even switch plans or enroll people without their knowledge and bad actor agents can buy lists of consumers with name of date of birth and use that very little information to enroll people into plans or to access plans and switch plans in the middle of the year. As Caroline mentioned, taking away commissions from the agents who worked closely with those individuals to pick a plan that fits their needs. And now they're losing their well-earned commission and putting people in harm by being enrolled into a plan that doesn't fit their provider network. So let's move on and take a look at how we need to start to view these and unpack and detangle these cases. And it's complex, especially last summer and fall as we started looking at this. We didn't know what these issues were, and so our natural course of work is, how did you get enrolled into this plan? And a lot of people really can't point to what happened to them. Their phone rang a million times. They had some conversations. They maybe put some information in a website, and here it comes. We've got insurance that doesn't work for us. It's part of our job as enrollment assisters or agents or CACs to assess for the correct enrollment. What is your household income? Where is your provider network? What is the proper enrollment for you? And to assess that and take those steps. And then to take the steps to disenroll someone and report to OCI in Wisconsin so that we can track those through regulatory action and see the Wisconsin trends. So let's look at the steps that enrollment assisters can do. First, we need to just start asking questions. And I always start when someone is referred to me by asking, how did you hear about my work, my navigator work at our community health center in our community? If you were referred by a trusted partner like 211 or a health system who knows that we do this work, or a friend, we know that that's a good start for you building a relationship with a trusted partner. And we take the time to explain what navigator work is. And very often in that process, as we're explaining the things that we don't do and the trusted sites that we use, then we hear the reports of, I tried to do this a while ago and my phone rang off the hook and I just stopped answering. So we're happy that people land in the correct place when they start getting help from someone like the people who are on our call today. Then we start digging into their situation. Do you currently have health insurance? Do you have a forward health card? Did you receive an additional health insurance card in the mail or any paperwork or emails? Did you receive some tax information from the health insurance marketplace that you don't understand? Or even worse, did you go to file taxes and have them rejected because you didn't have a health insurance marketplace related form? And in fact, we've heard from other states who work closely with the Volunteer Tax Association that there are many, many people this year who had to file extensions because they were flagged for not having the proper 1095A forms related to having health insurance that they didn't realize they had been enrolled in. This is coming up more and more, the question of, were you denied care? Did you go to your regular doctor and then find out that you couldn't attend a doctor's appointment because you had insurance that's now considered out of network? And who helped you sign up? And a lot of times we hear that, well, I talked to somebody over the phone, but I can't get a hold of them again. Or when I call that number, no one answers. Or I've tried to email back to understand more or get documents, and no one's responding to me. And those are all red flags that whatever activity they engaged in is not with an ethical agent or assister. And then because we're seeing monsters around every corner right now, we really do need to listen to the scenario, because not every situation where a plan doesn't work is an example of fraud. There are a lot of people who do their best to pick a plan and don't realize that they didn't properly filter or consider their provider network. There are many people who thought they lost Medicaid during the pandemic and got enrolled on healthcare.gov proactively. And then health insurance is just plain confusing. And so there are a lot of people who just didn't understand what they were picking when they picked their plan. So not every instance of coverage not working for someone is a fraud, but let's look at some cases that are. So here's an example of unauthorized plan switching. And then the next two examples, by the way, are examples that we've heard of. They are, in fact, actual similar situations. So here's a situation where Ava and Henry enrolled in a marketplace plan, knowing that Ava needed to have a procedure done in her health year, and they chose the plan that fit their provider network at 123 Health System. And because she had this procedure planned and chose this plan carefully, part of the pre-op procedures that health systems do is they make for sure that your coverage is in order, and they start that process. And Ava got flagged for having insurance out of network, and didn't understand this because they had carefully chosen their plan to allow this procedure. When they called the marketplace call center, they learned that someone had entered Ava and Henry's application without their permission and changed the health insurance company and added an agent name that wasn't their original agent. And that fraudulent agent was now receiving the commissions for having switched them into a plan in which they're contracted with. Next slide, please. So how do we help them correct this unauthorized plan switch? So as an assister, our first step would be to call the marketplace call center, and reporting fraud is one of their options. And believe me, this increase in activity means that call center representatives are very familiar when you start reporting fraud and having this conversation. And what that call center representative will do is verify the consumer information, ensure that they have the correct phone number, because an escalation is going to require the call center reaching back out to the consumer. So the immediate fix is that the marketplace can terminate that unauthorized plan, the plan that is not working for Ava and Henry. And then because they have experienced fraud, they can request to get enrolled through an SEP or the plan that's correct for them that will start the first of the following month. Sadly, even if they're calling in the middle of the month, we know that we can't get coverage to start until the first of the month. So the first step is to terminate coverage that is not working for them and to get enrolled back into the original plan that they want. Now, the next steps are the longer term fixes, and they require a request to escalate to a different tier of representatives. And that request is to request retroactive termination and reeffectuation of the original plan. And that's going to take some work on the marketplace's end. But we need to be aware that we can take additional steps here in Wisconsin by reporting this to our Office of Commission of Insurance. And to do that accurately and effectively, we need to ask, who is the insurance agent listed in this application and what is their ID number? So do record that information and save it. It will be useful when we file a complaint with OCI. So the health insurance casework, or HICS as we've called it for years, is another tier of call center representatives that help dig into these escalated circumstances. And they will call the consumer back to do some investigating. This process could take weeks, and we know that as they get busier doing this work, it could take longer than any of us are comfortable with. And in the meantime, consumers are, left to, move forward with their new coverage, but that the fixing of the retro termination and the corrections that the marketplace call center will make will happen over time. Do coach your people to watch for a phone call coming from the 855 number. And if they're concerned that the call that they receive from the marketplace call center is correct or not, they will always leave a message. You can call back with them and help advocate on that call. But they do need to be answering that call. If they don't, that case will be closed through the escalation process. Next slide, please. So CMS has provided guidance on what will happen when they escalate cases like this. And again, this is what CMS says should happen, that they will review the complaint to verify that the consumer's plan, which was unauthorized, that they will identify the original plan the consumer wants to be enrolled in, and then they will instruct the issuer, that's the insurance company, to reinstate the consumer into the original plan to cover all eligible claims incurred and accumulate all cost sharing towards applicable deductibles and annual limits on cost sharing as if they had not been disenrolled, meaning it's going to look to that consumer and to the insurance company as if they've been enrolled in the correct plan the whole time once CMS does their magical work. Again, this is what is supposed to happen. And this is going to take time for them to work towards this goal. We know, again, from other states and other navigators who've been doing this longer, that this does eventually work out, including that the IRS tax form that people get when they are enrolled in plans with tax credits are corrected to update the proper information. Next slide, please. So a follow-up of what happened to Ava and Henry is that they were able to terminate that unauthorized plan, go back to the original plan for a first of this next month, which was April for Ava. She had to reschedule her procedure when she had coverage that was recognized and accepted by her provider network. And they're going to have to wait for the escalation process to perform the steps that CMS has promised will make these consumers whole. Next step, please. So now let's look at another example of what they call an unauthorized plan enrollment on behalf of Marco. Marco is an example of someone that I worked with last fall, and it was my first exposure to a case that just didn't look right to me. Marco was receiving care for cancer locally. He had transitioned from employer coverage when he became too ill to work, had been granted a financial assistance program through the hospital, but of course was encouraged to see if he could find health insurance. And in so doing, did some exploration, started receiving all those aggressive phone calls and emails, and ultimately ended up getting an insurance card in the mail and really not understanding what happened. And prior to his next cancer treatment, he was told that the insurance that he had received was out of network and he was not able to follow through with that scheduled appointment. When he came to me, he really had no idea. He couldn't really track how it was that he got enrolled in this insurance, but he was referred to our assistance by his trusted care team. So let's look at how we started to unravel what happened to Marco. Again, we're calling this an unauthorized enrollment because Marco was enrolled into a plan that he didn't really understand. He didn't realize he was enrolled until he got a card in the mail. It was free to him, which meant he didn't have to pay anything to effectuate this. There was no consideration of his provider network or his health condition. And the bad actor agent who enrolled him into a plan didn't explain what he was enrolling into and didn't consider that Marco has a disability, that his income was low, that his assets were low, and didn't assess him for Medicaid. So this is fraudulent because this was an enrollment with somebody who didn't take into consideration Marco's actual needs and provider network. So let's see how we assisted. First, we called the marketplace to ask, is he enrolled in a marketplace plan? He has a card here from a company. Is this actual marketplace coverage? And it turns out that it was. It was a silver plan. It would have been a decent plan for him if it were in network. But again, take into consideration that he was very possibly Medicaid eligible. In fact, I assessed that he was and got those wheels rolling. So we terminated this marketplace plan that was not serving him by being out of network. And then we gathered the information from that healthcare.gov application, meaning we captured the name of the agent listed and the number associated with that so that we could file a complaint, and then took the steps to get him enrolled in Medicaid. Now, one additional step that I should have taken but didn't know it was important at the time, anybody who can look in the Forward Health portal, and that includes providers and billing agencies, and some of you who have access to the Forward Health portal, can see that private insurance is listed as well as Medicaid coverage. And if you have private insurance as well as Medicaid, private insurance is always going to be the first payer. So when we do ensure that someone is enrolled in Medicaid, we need to take the steps to call the Forward Health Member Service Portal and have them remove that private insurance. So that does not get pulled in as a payer source before Medicaid. And we, in fact, had to go back and request Medicaid be backdated for some services that could and should be covered by Medicaid when he had coverage out of network. Next slide, please. So this just reinstates the importance of having that primary health insurance removed from the Forward Health portal. And again, we mentioned earlier that we've not done a ton of these. We're learning a lot from our partners in other states who have a better workflow, or a workflow that's been working for them. And it's going to be important that we all start participating in these steps on behalf of consumers and tracking what's working for us, how long it's taking, and taking those extra steps to report this to the agencies. And we're going to look at those steps in just a minute. One part of this process is that anytime a consumer receives the subsidy from the marketplace to make insurance affordable, and we all know that the advanced premium tax credit, that generates a tax form that someone needs to use when they reconcile taxes. And anytime a plan switch is made or an update in the application, it generates a new version of that 1095-A form. The health insurance marketplace HIX process has to go back and make for sure that those 1095-A forms are corrected, or that they eliminate them for people who should not have been enrolled in a plan in the first place. So that's part of the process. Currently, 2024 forms can be updated as it's reported, but there are people who experiences these issues in 2023 and are again waiting to do their taxes until they get updated information from the marketplaces so they have a correct 1095-A form. So let's talk about the additional steps that are really helpful to report this both to our federal agencies and to our state agencies who track this information, who help make people whole, who report activities that are going on to the qualified health plans on behalf of agents that are performing bad acts that reflect poorly to those qualified health plans, because they don't want this activity to cause harm to their members. So there are additional steps that we can take. Through the federal agencies, there's a complex case web form that navigators and certified application counselors can use in addition to filing a HIX. And I believe that this goes to a different agency than the HIX caseworkers. I would, if I were using this complex case form, indicate that we had filed a HIX, but I believe that this is just another step for SSIO to track the prevalence of these cases and to follow and make for sure that people are made whole. Let's look at the next slide, please. Caroline is going to talk about the importance of filing and really the ease of doing an OCI complaint.
Thank you, Julia. And yes, so we talked about how to essentially help the person in real time, help them through a health insurance casework escalation, to report it to CMS through their complex case form. And at the same time, we want to make sure that we are also addressing this locally, because it's going to take a while for CMS to have essentially the fixes across the board where this is no longer becoming a prevalent issue in our community. So to be able to make sure that we're addressing it as quickly as possible, also informing our Office of the Commissioner of Insurance on any bad actors that hopefully we can address through their process. And I wanted to bring attention to how you can file. And this is their page of how to file a complaint and the information of what you need to do before you file. This is actually very helpful. Each dropdown talks through different things to consider what to verify, what you need in hand when you're actually trying to complete the complaint process. And then because of how easy it is, I wanted to actually just run through what an application or a complaint form looks like. One, you're gathering the information of who is submitting the complaint. So this could be any one of you. It does not have to be the consumer who was directly impacted, but if you saw this happen to a consumer, you can also report the bad actor or the bad company. Step 2 is talking about if there's any insurance company related to the incidents that you're complaining about. So it's not that they're necessarily the bad actor, but like what was the health insurance plan or insurance company that the person was signed up for or changed from or what have you that may also need to be contacted. And then we have the insurance policy. So this is information about if the consumer wants to be included, who the policyholder is. As you can see, all of these categories are not required. So this is where it doesn't have to be the consumer that is sharing all of this information, but rather you, the enrollment assister or community partner that wants to make sure that this bad actor is reported. Step 4 is where we actually report the agent or agency or person of interest that is causing harm. And one thing that Julia had mentioned while you're going through the resolution process through healthcare.gov or the HICS health insurance casework process is to ask for the agent number and the agent listed and their organization listed in the application of the consumer when you're working with them. And that's because you can also look up that information to get an address of their agency, essentially all of the relevant information that will go through this part of the report form. And so I left a link up for that lookup site. And it also will show you if they are indeed out of state, who they're affiliated with or licensed to work to sign people up for. What we tend to see in a lot of these cases are out of state folks, either from Texas, Florida. I think we had one from New York. And then what we additionally see is that they are typically contracted not with Wisconsin-based companies, but rather some of the larger health systems that they could be contracted with outside of Wisconsin, but they're harming our Wisconsin residents. So that's another thing to do in this step of gathering your information. And then step 5 is actually writing out the details of the complaint. So this is where you would explain what you saw as an enrollment assister and the concerns you have. You also have a section where you would then lay out what you think should happen in the resolution. And in those descriptions in the earlier part of the form, they explain what the Office of the Commissioner can do or cannot do in terms of resolution. And then step 6 through 10 is attaching any relevant documents to the report, getting the consent that you're willing to put forward this information, that it's true and accurate to the best of your ability, and that you preview the content that you submitted, and then finally submit. And I hope that you all take a opportunity, if you experience some of these cases, to please go through this process, because it will be what is needed to build a case here in Wisconsin that we can continue to share with the Centers for Medicare and Medicaid Services, and hopefully get these to be no longer an issue overall, or at least mitigated. So how can we prevent these scams? Well, Covering Wisconsin has been talking about scams since day one as we became navigators, because we saw and heard of instances maybe similar to this, but not quite what volume we've seen in these last year, essentially months and years. And so we have created resources, and this is our updated version of how to avoid health insurance scams that can be found on our website, that can be printed or shared on social media. And that is to get free, local, unbiased help. And so we go to our connector tool on Covering Wisconsin's website on wiscover.com, where people can look up local enrollment assisters. Many of you who are agents, brokers, navigators, certified application counselors are listed in our connector tool, whether you work with us directly as a navigator agency or you requested to be added, because we know through our processes in figuring out who is well intended to serve our community, that we included you. And we want people to utilize your services here in Wisconsin, because we know if they're getting local assistance, they're far less likely to be scammed. And then we also encourage folks that before they share any of their personal information, that they ask questions that a bad actor will not likely want to answer, which is, what is your license number? And then we show them where they can look it up, as I showed you earlier. Do you offer all of the qualified health plans that meet the ACA standards? Other questions that we also encourage are, what organization do you work for? Are you licensed? Can you explain or can you share information of how long you've done this work? All of those questions are questions that bad actors will stray away from and will not feel comfortable answering. And then, of course, we always promote that people should only apply on websites where it says .gov. So healthcare.gov is where you sign up for health insurance marketplace plans. access.wi.gov is where people sign up for Medicaid. And then other tips to share in the community are encourage consumers, once again, to work with folks here locally in Wisconsin. One, we provide help for free. We are also licensed and certified at both the state and federal level, and we partner with one another. The fact that we had 165 people here in real time, and we had another 100 folks registered because they want the recording of this, that shows the strength of our connections and our networks here locally, that people want to know how to help our community. And that's why we want them to work with folks at this level, because we know that they're going to get that quality of service here in Wisconsin. Of course, we want everyone, including everyone on the call, to be cautious of robocalls and unsolicited sales calls. They're prevalent, they're aggressive, and really they can cause a lot of harm if people don't know what they're getting themselves into. And then if people receive emails or other mail from another health plan, to reach out immediately to someone who is a trained enrollment assister to see if that was potentially a scam or if they were subject to a scam. And then, of course, to encourage folks to not enter any personal contact information on websites that are looking for health insurance. And then there's some minor exceptions because we promote wiscover.com, coveringwi.org, and healthymke.com regularly in our communities, but many others are usually directly associated with a lot of these out-of-state web brokers. And so I want to make sure that you all have access to where you can refer people if you need assistance. One, with consumers. So if you know people that have had issues around scams and just need help and have questions, you can get them connected to Covering Wisconsin through our online tool, which is our appointment connector tool, our phone number, which is directly connected to our navigators, and then our web chat, which is also available Monday through Friday, where people can directly chat with a navigator. And then outside of those business hours, they will get a call the following day. And I think this is important that people know where to find help if you yourself are not doing direct enrollment assistance. But then I want to also say for everyone who does, all of our agent broker partners, all of our certified application counselors, we at Covering Wisconsin are also your colleagues. We want to hear when you have cases. We want to help you if you have questions, if you need support. And this isn't about competition. This is really truly about making sure that the people that you are directly helping are served appropriately. And I've had wonderful relationships with a lot of enrollment assisters across the years where they will reach out and ask questions because they just needed a second opinion on an item. And that builds a lot of strength. If you're not already connected to our enrollment networks, I really encourage that you do, because that's also another place where we talk about trends and issues and concerns where we can definitely loop you into this partnership that we have developed over the years to make sure that we don't let anyone fall through the cracks. So with that, we get to our question and answer section, and I'm going to give it back to Adam so he can help facilitate our next steps.
Sounds good. Yeah, I thank you, Julia. Thank you, Caroline, for all that wonderful, very timely information. I'm pleased to say we have some great questions queued up, which is fantastic. I'm going to answer 1.5 of them, and we're going to give Julia and Caroline a break and do the OCI ones first, I think, and then we can get into some of these really good ones that are on some of these some specific scenarios and rules that we talked about today. First, Jeffrey Oliver asked, or he said, and I just want to address this, the complex case web form goes to the same office as the Hicks ticket. So this is the kind of the CMS reporting process that Julia was covering. Both are forwarded to the regional CMS office for review. That's really great information, and I actually really kind of pleased to see here, because Julia and I went back and forth about this, about whether or not that step was duplicative or not. I will add just one piece of context in that while we were researching for this, I did reach out to our CMS project officer, and she suggested still doing both, that the complex web form does track things a little differently, and that we would still want it there as well, because I'm really sensitive to people doing duplicative steps and efforts like that. As well, but that is good to know for context, especially if it's going to the regional office, because you got all these different moving parts and departments within the organizations that we have to refer to, and it's really important to understand how they interact together. So thank you for that one. I did want to also just address the verification documents needed to be submitted to the CDPU or Forward Health Portal to take the primary insurance off the case. I don't know that I understand that question well enough to address it, and I don't know that our panelists would either. So if you have, if you want to clarify that or add some more detail and kind of re-ask that one, we would be happy to kind of field it with that additional context. Otherwise, worst case scenario, we take it back, we look into it, and then come back to you guys with an answer later, which we are always happy to do. I am going to look at these two OCI questions next and turn it over to Amy. First one is the very first question that came in was, does OCI recommend or encourage agents, brokers, and other sisters to move away from Health SERPA and other, I think that's enhanced direct enrollment, EDE partners, instead of just using healthcare.gov? Amy, what do you think?
My opinion at this point, it's utilize whatever you're comfortable with. We're not going to encourage you just to go to healthcare.com. Or excuse me, healthcare.gov. We don't want to go to healthcare.com. That's not, that's a little scammy. The eventual hope is that CIO will put some guide rails in place around the EDE platforms. They're aware, obviously, of the issues. It's whatever is most user-friendly. The key is to enroll individuals. Don't let bad actors make your job more difficult.
Yeah.
I'm, as OCI, we don't have access to these platforms, so I can't make the determination on what works best for your role. That has to be an individual decision. Yeah,
I think that's right, Amy. And I think what you were getting at, the tools themselves are neither good nor bad, right?
Correct.
It's the people using them.
That is correct.
Well, and I wanted to just add a brief thing because this also made me think of one of the slides that Julia covered, which is where we were talking about all of the different healthcare.gov features that have been available to get more people covered. And, couching it in this conversation of, okay, that potentially opens more people to fraud. And it's definitely a delicate balance in resources and tools that help us all do our work more efficiently so we can help more people sign up for health insurance coverage and have access to the healthcare that they need. And then on the flip side, bad actors being able to take advantage of those tools and resources just like we are. And the balance is, do you want to take away these tools that really allow us to get to a lot of people by way of, eliminating fraudsters, people who want to do this work for their own benefit? Or do we regulate all of this and then actually minimize the number of people that we can ultimately get signed up, but the fraud is lessened? And so it's definitely, I visualize the balancing scales to make sure that really, and it's not our answer to make. It's, as Amy mentioned, it's going to be the federal government, it's going to be CISIO, but really that's probably what they're also determining is like what makes the most sense to make sure that people can have access to coverage at the same time as we're really reducing potential scams.
Yep, that's all right, I think. The other OCI specific question was, does having our info on the OCI as active agents put us at risk for someone, a bad actor to use our names, for example? I mean, I have my instincts on this question. I am going to let Amy take it. That does strike me as next level fraud. That is a little beyond the pale of what we were talking about today. If somebody were to do that, because I don't think that's what we're seeing. But Amy, if you have any thoughts specifically on that, I think people would benefit from hearing it.
Yes. So the only way that I can see that they would be able to is if they're presenting themselves as you in a phone call, because
Right.
unless you've provided them your NPN to utilize, which they should not be doing that, they can't portray themselves as you for you to be utilized as a bad actor. And because I'm here looking at as OCI having as active agents, you can on OCI's website, you can look up all agents, all licensed agents and agencies. So, the information is public. That is to ensure consumers have that data to verify who they're talking to. And as you said, and I have never heard or come across any situations where someone has misrepresented themselves as another agent. So I don't feel that is a risk at this point.
Yeah, I think that's right. Just because if you were to duplicate somebody's info in that way too, in theory, a lot of what's motivating these actions is getting the commission, right?
Correct.
So if you're purporting to be somebody else entirely, I mean, if you're an agent watching this right now and you get a strange commission, maybe let's pursue that and figure out what happened there. But no, Amy, thank you for that answer. I think that's really great. Let's go on down the list here. I think we've got a little bit of a nice variety based on some of the different points that were raised during the webinar that Julia and Caroline can tag team, and then Asiel or Amy could jump in if they have anything extra relevant to add. First one, do call center reps at healthcare.gov have the ability to identify a bad actor application, or do they appear identical to a legitimate application? I think this was covered a little bit, or in some detail, a little bit after this was asked, but I think we could go ahead and clarify.
I can take this one. I don't think that by name we can identify that it is a bad actor, but you can absolutely ask, can you please tell me the name of the agent listed in the application and the ID number? If we have identified that someone has been enrolled into a plan that doesn't fit their needs, that looks like fraud, we can ask for that information to use it in a complaint. And again, it's up to CMS and OCI to investigate, to uncover whether it truly is fraud.
Yeah, at the service level, the most service level of the question, I would say it's going to look like a regular application, but as soon as you look into that coverage and how it's being used and if it's right for that person or not, you see what the problems are. What are organizations doing in real time to manage the patients who need services but do not have an awareness of their insurance or indicate that they never signed up at all? So I think this speaks to kind of the identifying these folks, which is part of the problem and something that this webinar is helping to raise awareness of right now, which is finding a lot of it comes down to a point of service, right? When people find this stuff out. So organizations, I think the different HMOs and managed care organizations are, each of them is operating, they've got their own guiding principles and they're handling things differently in different ways. Some I would say are being more effective than others. I can't speak to a specific one because I don't know, but in theory, especially if they have CACs or have been involved in the conversations like the ones we're having today, they're identifying these people at point of service and then hopefully getting them to a reputable assister. I know some, like Julia, people connect with you directly. And that's really the best case scenario, is that they get in the hands of somebody who can help and is confident with all of these different terms and processes.
Yeah, absolutely, Adam. And I'll just add, I think each health system or any organization that has patients, it's going to be, each of them are doing things a little differently in terms of how they're managing the delivery of care. Obviously, if it's emergency care, then people cannot be turned away during those times. If it's chronic conditions or surgery and things that need pre-authorization, then they typically go through this insurance step. And so at that time, certified application counselors or any other financial counselors could help that individual at least get their stuff, their health coverage situated, so that they can move forward with the care that they need, whether that's getting onto a plan that does make sense for them. And then they could, at that point, make a referral to one of our navigators if they are not able to go and complete those next steps. So I'll say that. At the same time, I want all of our enrollment assisters to know that you do have the ability to do these next steps. And that's what this training is intended. And it's also an invitation to continue to learn as we do, because this is an ongoing issue that we are not done with. We are just getting started. And so I hope that you take this and then potentially through our conference, an opportunity to say, okay, I'm going to make sure that I'm looking for these as a way to help with, these out of network issues that I'm seeing in my organization.
And I'll build on that and kind of answer the question about what happens with Marco's care while this is happening in the background, and how does Marco continue to receive chemotherapy or other services while these issues are being resolved. First, in terms of Marco, I believe that he had a financial assistance program already established through the hospital, so hopefully there wasn't too much of a disruption in his services. My understanding is that providers are not required to provide care for people who don't have insurance outside of an emergency room. Health systems that have CACs that can start looking at this issue quickly and identify and help resolve may be able to communicate with providers in their health systems. Now that we see that CMS has assured that that there is a course of action for people, and that if they're enrolled in a plan that does not fit the provider network, it looks like there's a path for resolving that issue, and hopefully being able to assure your health system that eventually we will be able to resubmit a claim that should be covered by a correct insurance company. I'll tell you that I talked to a partner, a navigator partner in Texas, and they've been doing this for quite a while, and they have 100% resolution rate in this, meaning they have worked through these steps and fine-tuned their advocacy and efforts along with the marketplace and CMS, that they've been able to assure providers that they can, or assure consumers to ask providers to continue their care because they have every confidence that this issue with insurance will get resolved. I don't know that we have the experience here to say that we've experienced this and we know that we can help you resolve this. But I think CMS has shown us that there are steps to work towards that. It's kind of a non-answer. I think we'd like to be able to say eventually that we're able to resolve these with 100% resolution rates like our fellow navigators in another state.
Yeah, definitely. I mean, some of them, I mean, they had to arrive at that resolution rate the hard way because they've been doing this a little bit longer. So we're just trying to get out ahead of it right now and hopefully find ourselves in a way where we're dealing with these effectively and collaboratively as this webinar promotes. Question here that I think was covered pretty well in the presentation, probably after it was asked, which is how does this happen that agents are able to switch members, agent or NPN on record without them knowing? And does the FFM, so the Federal Marketplace, have safeguards in place to prevent that? I think we saw some examples. So there's these third parties, there's Health Sherpa will let you do it. I mean, the actual, healthcare.gov will let you do it. It's just whether or not it's how much information they're giving the member while they're quote unquote helping them. It's very easy for these fraudsters to say, hey, I'm an agent, because technically true, and I can help you get, the cheapest insurance or the best price or whatever is resonating with that particular consumer at that moment. And in terms of, are there safeguards in place? I think what we've seen is not enough. Kind of like that question on identifying these kind of bad actors, these fraudulent applications on the CMS side of things. At the surface level, there's nothing wrong with the application. It was done, there was an assister involved, but it's when you go to utilize that care that we see these issues. Yeah, Julia, do you want to add to that?
I don't, and I'm sorry to pivot, but I want to ask a question because someone's on this call that I've worked with for years who might have an answer, and I want her to type the answer into the question and answer if she knows it. And the question is there anything required when you call Forward Health Member Services and ask to remove commercial insurance or private insurance from that portal? I know that my fellow colleague Dolly is in this virtual room, and that she's talked us through this. Dolly, if you wouldn't mind chatting or adding your answer into this Q&A as an answer, because I know you've coached us on this before. Do we have to provide any verification that there's no longer private coverage, or can we just request that be removed? I'm crowdsourcing that answer, Adam.
That's okay. That sounds good. All right. Going back through the questions here. So this, Julie, I think one of your sections got into a little bit here with the what recourse do health systems treating these patients have if services already rendered, and at time service their Medicaid product showed as active or eligible, and there was no other alert of coverage. So in their area, they're seeing a lot of patients with pathway exchange that is not out of network, and they're receiving a lot of out of network denials as a result. So go ahead, Julia.
What was the question? I'm sorry.
No, so basically, what recourse do health systems have for the service that was already rendered? And I think this gets pretty well into what you were describing when you're talking about sort of the CMS resolution, the way things are supposed to work in terms of those claims actually getting covered.
I don't have an answer for that yet. I don't think we've got the experience. Caroline, do you have a sense of what happens?
Well, I was just going to ask.
Denied?
Well, and I was just going to ask if this was reported, not specifically the insurance agency, but the bad actor, would this fall into anything in terms of making the person whole, Amy, in terms of what OCI is able to require health insurance or health plans to do?
With the marketplace, that there's potential. That's a difficult. It's all situationally dependent. So one of what Caroline's referring to, one of the recourses we have if an agent has misrepresented something, the insurer is responsible for the acts of the agent, and we can request the insurer make the consumer whole. But that is all dependent on the entire process and what is uncovered as part of the investigation.
Yeah, so and I wanted to emphasize that of course it would be conditional. So thank you, Amy. It was more so encouragement of, in those situations, we still don't know what the best approach will be, but when we start to report them, then we can uncover how essentially how we can fix these concerns that we're seeing. So I think at minimum reporting the fraud is the best place to start.
Yep, great. And then Jasmine Clark's question, how can we determine if a consumer is a victim of a bad actor scam if they enrolled in the plan through a broker website, physical location in another state, but the website says they're licensed in Wisconsin? I think this was pretty well covered by the material, probably after this was asked. It really comes down to investigating that particular person's circumstances and situation. These out-of-state, brokers, yes, you could find them. You'll see, that you see the physical location, you'll see they're licensed to operate in Wisconsin, but it comes down to when the consumer goes to use that plan, if the right thought and education went into the enrollment, to verify that, that they were shown all of their options and that they were shown the right networks and not just signed up for that $0 plan. In terms of identifying these, one of the telltale signs or the pretty common occurrences is that these tend to be the plans where the premium tax credit is high enough that the person won't have an out-of-pocket monthly premium. So whether or not that's a good network for them, it usually isn't, or at least in terms of these cases, because they weren't shown the right options. So determining them, it requires working with that consumer directly and identifying those different factors and seeing if they, what they remember from that interaction with that other actor and if they were shown enough options. All right, getting into some more interesting ones. I want to see if Dolly had a response here.
Adam, Maciel
yeah.
also had a response for that.
Perfect. Yeah, let's jump back into that one. Go ahead, Maciel.
So before we jump the gun and we talk about providing verification to Forward Health or CDPU regarding the third-party insurance, I would like to first reiterate the fact that we need to verify if this individual was a victim of this particular scam. What we need to do is verify and rule out what took place, get that addressed first and foremost. Once it's confirmed, and Caroline, you can speak to what the process is you already have on this particular webinar, but making sure that they follow the protocol or the process that's needed. And then once that is confirmed, then I would imagine what Dolly was going to put in the chat or something, that there's verification that that was removed from their eligibility screen or what have you from the marketplace, and then letting the Forward Health portal know to remove that because it should no longer be showing as effective.
Yep, and I'll just reaffirm, Maciel, what you said. So, and what Julia has said is that you have to do the healthcare.gov step first in terms of, going through that process of, getting them on the right plan, or if they were duly enrolled in both Medicaid and a unauthorized marketplace plan, getting that plan terminated is a way of showing that, okay, we were able to terminate this plan because it was fraudulent. And you will get that confirmation when you talk to someone through the health insurance casework escalation process. And that's when you then are able to go back to member services to confirm that they should not have this plan on their record, and then to go through those steps that Maciel had laid out. So that's why it's so important for us to make sure that that person essentially is that we are helping them identify if they are indeed in a fraudulent plan or unauthorized plan situation so that we can best react to the follow-up that's needed, whether it's asking for services to be backdated or what have you, if they're Medicaid enrolled.
And also, I should mention, I know that Caroline alluded to this in her presentation, but the department is in the process of providing communication to member services, to the IN workers, and also to the HMOs. In terms of providing verification right now to member services, we're still in the process of finalizing what is to be expected and such. However, if you're experiencing some issues with that or anything like that, please feel free to email me directly through Caroline, and we can work those situations out until we formalize and finalize that situation or process. Thank you.
All right, and we're short on time. I've got a few more questions in here. Quintella messaged me directly, so I'm going to take that one offline with her. And then, let's see, why isn't there some hard stop when Forward Health has a primary interest listed as marketplace plan, since you can't have both? I see it happen all the time. I don't understand why it can't be caught right away. I can speak to this a little bit. I mean, some from a limited understanding. So there's a little bit of understanding, a little bit of ignorance here. But my guess would be that programming that to accommodate all of the different scenarios in which different coverages would appear in the Forward Health portal would be very difficult and challenging to make sure that you aren't messing something else up, or that something else might be missed that's important. So I'm guessing that it is better and more inclusive for people to have it programmed the way it is, rather than a very difficult, nuanced solution to catch some of these.
And to point to some of the guardrails that have been lifted, especially during the pandemic, is that they used to flag through their data exchanges at the marketplace whether you were enrolled in both Medicaid and marketplace on a quarterly basis, and send out notices and ask people to confirm, are you supposed to be enrolled in the marketplace or Medicaid, and terminate one or the other of those. And they've not done those kinds of data exchange comparisons throughout that whole continuous eligibility program. So now, 3 years later, since the beginning of the pandemic, we're still uncovering many people who were duly enrolled for many years.
Yep. I'll do one more question since we are at time, and I thank all of our panelists and especially our two amazing presenters for all the information they shared today. And I think we have covered this pretty well, and I think this is a reiteration of the other question, but is there any other context to this, any other answer for what recourse health systems have if a member is unaware that they have a marketplace plan and it is not showing them in their eligibility as having a plan? So the claims are getting denied over network. So it continues to be that question of these out-of-network claim denials. And I think we covered that pretty well, but if anybody else has any final thoughts, I think a lot of this comes down to what we choose to do with all the information that we have today moving forward. Because a lot of these resolutions, we know what they're supposed to do. We know how they're supposed to work. And we just need to see more people utilizing all of the correct channels and all of these, all the safeguards put in place and the different reporting processes to make sure that we are addressing as many of these as we possibly can, and to make sure that the issue that is plaguing consumers is being raised to the profile it deserves to be. Yeah, Caroline.
And I was just going to say, and if you need help and you have questions, please reach out to Covering Wisconsin. So we're here to help.
That is a great point to end on, because I think that is absolutely the case. If you need help, if you have any questions, anything that wasn't answered, anything you think of later, or you encounter one of these today, tomorrow, next week, just get in touch with us if you need any help at all. We will be sending out the recording as well as an evaluation a little bit later to all of our registrants. Thank you all for your participation today. Thank you all for these great questions. Really made for a wonderful discussion of this very timely and pressing issue. And thank you again to our amazing presenters and panelists.
Thank you, Adam. Thanks, everyone.
Have a great rest of your week.